Hello, my name is Deanne Cruse, and my project is on the racial biases and perceptions of mental health symptoms among undergraduate psychology students. And so, what is schizophrenia? Schizophrenia is a but a psychological disorder wherein the symptoms have positive and negative symptoms, and the positive symptoms are like hallucinations, delusions, disorganized speech, and the negative symptoms include anhedonia, which is the inability to feel pleasure, abolition, which is the lack of motivation or ability to complete tasks, and also social withdrawal. And it affects about approximately 24 million people worldwide. Diagnosis can be very, very, very complex when it comes to this disorder because you have schizophrenia, you have schizoaffective, which has two subtypes such as bipolar and depressive, and then you also have depression with psychotic features and bipolar with psychotic features. And the difference between schizoaffective and schizophrenia is that the individual has psychotic and mood disorder symptoms, and that the psychotic symptoms have to occur also not only during mood symptoms, but also without mood symptoms for about 2 weeks, at least 2 weeks. And bipolar with psychotic features and depression with psychotic features, the psychotic features only come out during the mood symptoms, no other time. So African Americans are 2 to 5 times more likely to be diagnosed with a schizophrenia spectrum disorder. And that was done from a study done by Barnes in 2013. He looked at data from a national survey conducted in the 90s. And he found that veteran affairs hospitals were actually the least likely to misdiagnose someone with, overdiagnose people of African American heritage. And also, general admission hospitals were the most likely to overdiagnose. And also, another study found that African Americans were significantly more likely to screen positive for moderately severe to severe depression when compared to Caucasians in 2018 by Rygara. And that means that mood disorders with psychotic features can be diagnosed wrongly as schizophrenia. So some possible theories as to why this happens is because it may be partly due to clinician bias. Mental health practitioners may confuse cultural and or racial themes for hallucinations and delusions, such as an example of that would be like, oh, the man is trying to hold me down or something like that, and racial bias, and there may also be racial bias in behavior-based diagnostic measures for schizophrenia, meaning that we also diagnose schizophrenia based off your behavior, and so if we have an overdiagnosis of African Americans, then we're going to base our diagnostic measures on mainly the African Americans' behavior as opposed to everyone with the disorder. So our hypotheses. Our purpose of the study was to test whether psychology students would show racial biases in evaluations of hypothetical characters' mental health symptoms. And the hypotheses were that students will be more likely to evaluate Black characters having symptoms consistent with schizophrenia relative to a white character, and also that those explanations of the various disorders will show less racial bias because they will be known more about the symptoms attributed to each diagnosis, and so basically it will serve as a training simulation for the undergraduate students. And also, depressive symptoms condition will show higher racial bias relative to the bipolar symptoms condition, and that's because bipolar disorders are just overall more likely to be misdiagnosed regardless of race. So if we had a study and we recruited undergraduate and master's students and also recently graduated undergraduate and master's students. Unfortunately, we only received undergraduate students who filled out our survey, and they had to have taken abnormal psychology, and we got about 75 complete responses. And the age range was 18 to 42, with the mean being 22, and our participants could select all the race options that they wanted to, and that best fit their situation. And we had mainly Hispanics, with Caucasian being the second, and African Americans and Asian tied. I thought it was interesting how we had non-binary / genderqueer as the second highest gender for our study, as opposed to men with 8%. It doesn't have anything to do with the study, it's just interesting. And so we had a 2x2x2 study where we would give them explanations of the disorders, which would be schizophrenia, schizoaffective bipolar subtype, schizoaffective depression subtype, bipolar with psychotic features, and depression with psychotic features. And then we would also have them receive 1 or 4 vignettes wherein they would receive information regarding a character named Hayden or Tyrone. So we changed the name based off how we thought they would perceive the race. And so Hayden would be for the Caucasian character, and Tyrone would be for the African American character. And so we had Hayden with bipolar with psychosis, and then Hayden with depression with psychosis, Tyrone with bipolar with psychosis, and then Tyrone with depression with psychosis. And so we have them rate the likelihood of them having each disorder, as you can see here, on a 1 to 10 scale, with the different disorders that we gave them information regarding as to what they were. And so, for our likelihood of bipolar, we focus on the ratings of likelihood for the results section. We also had them do other things, but we didn't find significance or anything interesting with those. And so it was like the participants in the bipolar symptoms condition rated the character's likelihood of having bipolar disorder with psychotic features as higher than participants in the depressive symptoms condition did. And although the data is not shown, participants in the depressive symptoms condition rated the likelihood of depression with psychotic features as higher. And what this basically means is that, what this shows is that in general, our participants were able to correctly distinguish elements of bipolar versus depression. And so they were able to distinguish whether or not this person has actual bipolar or depression symptoms. And so we had a 3-way interaction, as you can see here. It was very interesting. I thought it was really cool. And that meant that having explanations decreased the likelihood of endorsing schizoaffective bipolar subtype for the African American character in the bipolar symptoms condition, but not for any other characters. And also, although the data is not shown, for schizoaffective depression subtype, the only significant effect was higher likelihood in the depressive symptoms condition. And we also had another, not significant all the way, but it was barely missed the significant mark with a 0.051 T. And that meant that having explanations decreased the likelihood of endorsing schizophrenia for the African American character in a bipolar symptoms condition, but not for any other characters. And so for our discussion, we did not find any evidence that Black character was more likely to be evaluated as having symptoms consistent with schizophrenia spectrum disorders relative to a white character. However, including explanations of the conditions prior to the vignettes decreased likelihood of characterizing Black characters with schizophrenia spectrum disorders. And specifically, when the vignette describes symptoms consistent with bipolar with psychotic features. Maybe the explanation served as a educational intervention, which heightened the participants' awareness of potential stereotyping when the character had an African American name. It's interesting because we didn't mention any racial bias at all in our explanations when we were giving them that. And so we had a small sample size. It was only about 75 students. We had more than that actually, like about 112 or something. But when some of the participants saw the explanations, they went away. It was like, it was very sad. And so undergrad students also aren't qualified to diagnose others. However, some will get specialized training such as an MD or a PhD to be able to diagnose patients as clinicians in the future. So this study shows preliminary evidence that early intervention that clarifies the differences between mood disorders and schizophrenia spectrum disorders may help counter stereotyping and evaluating mental health symptoms. Also, future studies could assess the impact of explicitly teaching about racial biases and diagnosis of mental health conditions, undergrad understanding of mental health symptoms. I want to say thank you to Dr. Goldie and to my friends who were supporting me, and also to my parents who listened to me talk about this subject for way too long on and on. They had no interest, but they all listened. And so these are my sources, and any questions? Yes.
In the studies that you talked about at the beginning that did show racial bias in the diagnosis, did it at all highlight what the races were of the clinicians?
No, not really, because for the, I know for Barnes, he was just looking at a study done in the 90s, and it didn't it was just data from each hospital. Like, he collected all the data from the hospitals and they put it into one report, and so it's just like a meta-analysis basically of the report. So he couldn't get any of the doctors' races and whatnot. I don't think the other studies also highlighted that stuff, so no. Yes.
This is a really cool study. My question is, so did you indicate gender at all with the two people?
No. I mean, I think so, yes. When we were in the vignettes, we said Hayden, and then we would say he instead of she or they. And the reason why we didn't use a female at all, or someone who is genderqueer, is because women, and I'm assuming also genderqueer individuals, although they haven't been studied that well, is that they are more likely to be misdiagnosed, just in general, no matter what, so it's hard. Yes.
So why do you think why do you explain that really made a difference? One, for mindfully updating the study, and two, do you have any insight on why they really internalize that and change their diagnosis of what that race is?
There was another study that I didn't mention because it was a very poorly done study. I mean, the reason why it was poorly done is because they were arguing the fact that racial disparities in schizophrenia didn't actually exist, because they said that they were basically giving training to the physicians and then having them diagnose the individuals in an actual mental health study and setting, and then they were saying, oh, the disparities don't exist because these doctors didn't misdiagnose anyone. It was really weird and convoluted, as you can see. And so in that one, they also had training and people weren't being misdiagnosed or they weren't being overdiagnosed at all. So. I think that may answer.
Yes.
Any other questions?
This isn't about your research specifically, but you pointed out the demographics on yours, and then I noticed demographics on the other ones that had a lot more women participants. Is that common in like studies, or do you put out the whole more participants that you get more women?
I think it's mainly for mine because, at least for mine, because the psychology students are mainly women, and also St. Ed's has a higher female population as well, and also women in general are more likely to go to college nowadays than men, so that may also contribute to Christina's study. So.
Any other questions? One more time. So, as I get a peer pressure, I try not to cry when I think about all of these works are graduating. But I first got to know Deanne in animal behavior class in spring of 2020. And we all remember what happened in spring of 2020. And we all had gone online that semester. One of the things I missed most was Deanne sitting in the, so picture it, back right corner of animal behavior and always raising her hand to ask and or answer questions, often questions that I did not know the answer to and had to go learn more, which is one of the best things about being a professor. And so when it came time for Deanne to do the thesis, she knew exactly what she wanted to study. She wanted to study racial disparities in schizophrenia diagnosis. I honestly know very little about that topic. I am not a clinical psychologist, so I got to learn a lot. And throughout the whole project, one of the things I really admired was that Deanne never wanted to do things the easy way, which is the sign of a good researcher, right? It's like, okay, we can have, like a vignette, one character can have an African American name, and one character can have a white name, and we test the difference. And Deanne was like, well, we should look at whether you're giving explanations of the diagnosis matters, right? Which obviously it did, right? And we should look at whether the symptoms are more consistent with bipolar depression, because bipolar is more likely to be diagnosed, and obviously that mattered as well, right? So those tensions were really, really correct. And I really enjoyed Deanne's mix of curiosity and research skills, whether it's having her pass or through thesis, or hearing her talk about her Chinese class, or being with the board games in our honors seminar last semester. So I know that Deanne is going to be an